Good day. I'm Christian Camargo, and today I'll be presenting the reaction study. Reaction stands for reducing the effects of aging cognition with therapeutic intervention of an oral multi-nutrient combination. And this is our study, of which I'll be presenting its design and baseline results. As many of us are aware, Alzheimer's disease does represent the most common cause of dementia, and the risk of developing Alzheimer's disease increases along with age. Age-related cognitive decline refers to the cognitive changes that also occur alongside the aging process. Research recently has suggested that the mechanism that underlies age-related cognitive decline is the loss of synaptic plasticity and altered dendritic spine morphology. What is curious and interesting about this finding is that this is a very similar phenomenon to what is observed in Alzheimer's disease, a very similar pathological process. Suvinade, the intervention in this clinical study, contains a specific combination of precursors and cofactors, specifically choline, uridine monophosphate, and the omega-3 fatty acids, with the combination of which has been shown to be beneficial on memory, cognition, and brain atrophy in prodromal Alzheimer's disease. In addition, data from the lipid diet trial has suggested that there was a stronger effect when this intervention was utilized at earlier stages of prodromal Alzheimer's disease. In order to test the effect of Suvinade on age-related cognitive decline, we designed the reaction study. The reaction study was designed and is intended to be a pilot study. As a pilot study, therefore, it is a feasibility study with a double-blind, placebo-controlled, randomized design. It is meant to be conducted over the course of a 6-month intervention in which we'll be recruiting individuals age 55 through 89. The goal will be to recruit individuals within that range with age-related cognitive decline. These will be individuals who, by definition, do not have any kind of criteria for major neurocognitive disorder or dementia, or even pathological cognitive impairment. These individuals will be screened via the following process. They will have, as per criteria set forth by our neuropsychological team, a MoCA above 24, greater than 70th percentile on the R-Band's list learning retention task, and greater than 80th percentile on the story memory retention. In addition, to ensure avoidance of the ceiling effect, we will also assess that they are in the middle 50th percentile on the SCD-9 subjective cognitive complaint questionnaire. What is unique to this study in the context of the COVID-19 questionnaire that has affected our world in the last several years is the unique nature of its virtual implementation. In fact, it is conducted entirely virtually, and all assessments, including the screening that I have just mentioned, were conducted via a virtual platform. The only in-person interaction was the handing off of the study product, which was, of course, done on a contact-free basis. As mentioned, the primary outcome of the trial is feasibility, with recruitment rate and time, adherence rate, and retention rate being investigated. Other outcomes, including, of course, cognitive measures to investigate things such as memory, broader cognition, and quality of life, will be measured on an exploratory basis. Preliminarily, we have been able to gather data on our recruitment, given that over the course of the previous 12 months, prior to the point of when we completed recruitment, of course, we were able to meet our goals. That is to say, we had a total of 292 points of contact. All the way down, you can follow the path here to see that we met our goal of 60 individuals who were eligible for randomization. Of these, we had planned on randomizing all of these 60 to either Suvinade or placebo. You can see along the path of the chart those individuals who either had been pre-screening failures or had lost contact or failed screening due to one reason or another. Unfortunately, one individual who was in the process of randomization had to withdraw due to unrelated medical circumstances. Ultimately, 59 individuals were randomized to Suvinade or placebo. Table 1 allows us to see the demographics of the 59 individuals that were randomized to Suvinade or placebo. And we can see a mean age of 69 with a standard deviation of 8.76, consistent with our recruitment age goals. We can see 19% male sex, which shows a significant predominance of females in the study. 95% white race and 5% black race. And uniquely, a 47% Hispanic population, something that speaks to the very heavy Hispanic population of South Florida. A highly educated population, 17 years education, a MoCA score of 28 with a 1.6 standard deviation, which again falls within expectations based on our screening criteria, and the individual R bands and subjective cognitive complaint questionnaire scores are listed there also for review with very narrow standard deviations, again suggesting that this population all seems to fall within a very similar profile. Table 2 shows the feasibility variables that will be considered for this study. As mentioned previously, the recruitment rate and time, the adherence to intervention, and the retention rate. Ultimately, the results based on the parameters and ranges provided will be deemed feasible under certain conditions, or not feasible, again, based on these cutoff values. And the overall feasibility will be determined based on taking into account all feasibility parameters. In conclusion, we successfully randomized 59 individuals to Suvinade or placebo. The 47% Hispanic population participation rate reflects the diversity of our sample and is a remarkably large percentage compared to most other studies in the United States, and reflects the growing Hispanic population of the United States, as well as a diverse population in South Florida. The 19% male population rate does represent the challenge of recruiting men in South Florida. As of June 2022, recruitment is complete and data collection for the primary feasibility and exploratory efficacy outcomes continues. With the rapidly growing prevalence of age-related cognitive decline and the limited pharmacological curative treatment options that are currently available, nutritional interventions may potentially play a role, an important one, that is to say, to prevent or delay the onset of age-related cognitive decline, especially as many of these individuals may or may not have Alzheimer's disease pathology and be unaware of it. We'd like to thank, of course, the American Academy of Neurology, which is the primary funder of this research. And this is the clinicaltrial.gov identifier. I am the corresponding author. Thank you for your time.